Dialogues, your daily dose of health and medical news. I'm Mr. Zaman, and here's what I bring to you all from the world of medicine. Cardiorespiratory fitness is improved by exercise during and after chemotherapy. During chemotherapy, physical exercise intervention is safe, improves long-term cardiorespiratory fitness, and alleviates some of the adverse effects of cancer treatment, according to a study published in JACC Cardio-Oncology. If exercise isn't feasible during chemotherapy, the individual can participate in an exercise program afterward to recover the same level of function. In the ACT trial, the researchers examined the efficacy of exercise intervention during chemotherapy compared with after treatment for improving long-term cardiorespiratory fitness. Adult patients recently diagnosed with breast cancer, colon cancer, testicular cancer, or B-cell non-Hodgkin lymphoma who were scheduled to receive curative chemotherapy were eligible for the study. Risk of multiple diseases increases if you get less than 5 hours of sleep a night, according to a study. Getting less than 5 hours of sleep in mid to late night could be linked to an increased risk of developing at least 2 chronic diseases, finds a new study led by UCL researchers. The research, published in PLOS Medicine, analyzed the impact of sleep duration on the health of more than 7,000 men and women at the ages of 50, 60, and 70 from the Whitehall 2 cohort study. Researchers examined the relationship between how long each participant slept for, mortality, and whether they had been diagnosed with 2 or more chronic diseases or multimorbidity, such as heart disease, cancer, or diabetes, over the course of 25 years. Future risk of dementia can be lowered if early depression is timely intervened, according to a study. Depression has long been associated with an increased risk of dementia, and now a new study provides evidence that timely treatment of depression could lower the risk of dementia in specific groups of patients. Over 55 million people worldwide live with dementia, a disabling neurocognitive condition that mainly affects older adults. No effective treatment for dementia exists, but identifying ways to help minimize or prevent dementia would help to lessen the burden of the disease. Important step in pursuit of HIV care taken by Danish researchers. For over 40 years, scientists all over the world have been unsuccessfully trying to find a cure for HIV, but now a team of researchers from Aarhus University and Aarhus University Hospital have apparently found an important element in the equation. Today, people with HIV are offered so-called antiretroviral therapy, which suppresses the amount of virus in the blood and partially restores the immune system. However, if the standard treatment is discontinued, the amount of virus in the blood rises within weeks to the same level as before the standard treatment was initiated, regardless of whether the patient is 10 or 20 years into the course of treatment. Now, this is because HIV hides in the genome of some of the body's immune cells, and it is precisely these cells that the intervention is targeting in the Danish-led research project. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.